Every 12 seconds, someone drowns. Every 23 seconds, someone dies in a road crash. Every 11 seconds, a worker doesn't come home. Right now, as you're watching this, 2.7 million people died last year globally from something completely preventable: accidents. From the streets of Delhi to the highways of America, from Bangladesh's roads to Europe's workplaces. These aren't just random tragedies. They follow patterns. And understanding these patterns could literally save your life tonight. Welcome back to Health Science for All. Here's the global crisis nobody talks about. Accidents kill more people than diabetes, Alzheimer's, and kidney disease combined. We're talking about 7,400 deaths every single day worldwide. In America alone, 222,698 accident deaths. India, over 270,000 from road accidents alone. Bangladesh, 7,094 road deaths just in 2024. Europe, 122,000 workplace deaths annually. But here's what's truly disturbing. Accident deaths are increasing globally. We have self-driving cars, advanced safety technology, and medical miracles. Yet more people are dying from accidents than a decade ago. So what are these 5 global assassins hiding in plain sight? Let's count them down. Number 5. The place you spend half your life. Work. 2.9 million workers die globally every year from workplace accidents and diseases. The shocking global reality. Asia-Pacific accounts for 63% of all workplace deaths. India's true workplace deaths. 40,000, not the reported 222. Europe. 3,347 fatal accidents in 2021. America. 5,283 deaths in 2023. The deadliest jobs globally: mining in China, construction in India, logging in America, fishing in Bangladesh, agriculture everywhere. Here's the inequality. Men die at twice the rate of women at work, 108.3 versus 48.4 per 100,000. Africa has the highest percentage of work-related deaths at 7.39% of all deaths. With only one inspector for every 70,000 workers in America, and even worse ratios in developing countries, the system is failing workers worldwide. Number 4 burns through families worldwide: fire and burn deaths. The global toll is staggering. While developed countries see declining fire deaths, developing nations face increasing threats. America, 3,800 annual deaths. India and South Asia, thousands die in cooking fires. Children under 5 globally are twice as likely to die. But here's what's truly terrifying. 70% of fire deaths aren't from flames. They're from smoke inhalation. In India and Bangladesh, indoor cooking fires with poor ventilation create toxic death traps. Your modern home, whether in Mumbai or Manchester, burns 8 times faster than homes did 50 years ago. Those synthetic materials, they release hydrogen cyanide. You're not burned to death, you're poisoned while you sleep. The prevention gap. Over 86% of countries have residential fire safety codes. Number 3 is killing 30 people every hour. Drowning. 300,000 people drowned globally in 2021. The global drowning crisis. 92% of drowning deaths occur in low and middle-income countries, Southeast Asia and Western Pacific. 56% of all drowning deaths, Bangladesh, India, Nepal. Among the highest rates globally, Africa, drowning rate of 5.6 per 100,000, highest globally. The inequality is heartbreaking. It's the #1 cause of death for children ages 1 to 4 worldwide. In America, black children drown at 1.5 times the rate of white children. In Asia, 90% of drowning occurs in rivers, lakes, and domestic water storage. Only 15% of African countries have drowning prevention strategies compared to 45% in Europe. The result? African drowning rates barely declined 3%, while Europe's dropped 68%. Number 2, the global road massacre. 1.35 million people die on roads worldwide every year. The devastating country breakdown. India, 171,000 plus deaths, highest globally. China, hundreds of thousands, underreported. Bangladesh, 7,294 in 2024. Nepal, 2,500, 2,883 annually, 7 deaths daily. America, 43,273 deaths. Europe, lowest rates, but still thousands. The death rate tells the real story. Africa, 26.6 per 100,000, highest. Southeast Asia, 18.5 per 100,000. Europe, 9.3 per 100,000, lowest. Two-wheelers are the hidden killer. In India, they account for 45% of road deaths. In Nepal, motorcycle accidents dominate. The poor die at 3 times the rate of the rich because they walk, bike, or ride in unsafe vehicles. Young men aged 15-29 account for 59% of global road deaths. We have normalized this rate across every culture. And the #1 accidental killer varies by region but shares one trait: it's completely preventable. In developed countries, drug overdoses. America, 304 deaths in 2023. Europe, rising opioid crisis. 27% drop in 2024 shows prevention works. In developing countries, the combination of all factors, indoor air pollution from cooking, millions affected pesticide poisoning in agricultural communities, industrial chemical exposure. The global poison crisis isn't just drugs. It's the toxic air in Delhi killing thousands. It's pesticides in rural India and Bangladesh. It's carbon monoxide in Nepal's poorly ventilated homes. It's lead in water supplies across Africa. Together, poisonings, whether from drugs, chemicals, or pollution, represent the fastest growing category of accidental death worldwide. But here's what nobody tells you. These killers work together across borders. Alcohol contributes to 40% of drownings in Europe and road crashes in India. Work injuries in Bangladesh factories lead to opioid addiction. Poor road infrastructure in Nepal multiplies every other risk. Indoor air pollution in India increases fire deaths. Poverty everywhere multiplies every single risk. The same factors, poverty, inequality, weak regulations, create death traps whether you're in Lagos or Los Angeles, Dhaka or Detroit. Here's what can make you angry. Your country determines your death risk. African road deaths, 3x higher than Europe. South Asian drowning, 5x higher than developed countries. Workplace deaths in Asia, 63% of global total. Rural populations everywhere, 2x the accident risk. If you're poor, you're more likely to die from walking on dangerous roads, working in unregulated factories, living near polluted water, having no access to emergency care. This isn't about accidents. It's about a global system that values some lives more than others. So how do you not become a statistic wherever you live? Immediate actions. Today, install smoke alarms, reduces fire death by 50%. Lock up all medications and chemicals. Check ventilation to prevent carbon monoxide. Never use your phone while moving. This week, learn CPR, works globally. Learn to swim, 88% reduction in drowning risk. Get safety equipment for work. Plan safe routes for daily travel. Life changes. Never drive impaired, including tired. Wear helmets on two-wheelers, 40% reduction in death. Advocate for safety regulations. Create community safety networks. Country-specific, India, Bangladesh, focus on road safety and helmets. Nepal, improve home ventilation. Africa, water safety and first aid training. Everywhere, build safety culture. Look, these aren't accidents. They're predictable, preventable tragedies. Thailand reduced road deaths through enforcement. Europe eliminated most workplace deaths through regulation. Bangladesh is tackling drowning through swimming programs. Solutions exist. They just need implementation. Every safety regulation was written in blood. Every prevention program represents lives saved. You now know what 99% of people don't. The 5 accidental killers threatening lives globally and how to prevent them. Your assignment: pick 3 prevention actions. Do them today. Share this with someone in your country who needs to hear it. Hit subscribe and the notification bell. Our channel serves viewers all over the world. We're all in this together. Share this video. The life you save might be in your own community. Remember, there are no accidents, only preventable tragedies we've normalized. Stay safe, stay informed, and stay alive. I'll see you in the next video.